Yes, as far as I have understood, it's a block in the circulation into the bloodstream of the heart, which causes the heart decomposition or moving ways it should not do so, and then up stopping or cardiac muscle is injured, and that causes you to die.
A heart attack is when your heart stops beating properly because it's not getting enough blood.
This usually happens when fat gradually builds up over time in the arteries in your heart, making them get narrow.
Your arteries are very narrow, your blood can't flow through them, and your heart doesn't get enough blood.
Your heart needs oxygen to work, and with no blood, it means no oxygen, and this can lead to heart damage or death. According to me, is cholesterol, lack of exercise. It may be something genetic or some deformation of the heart. Basically, as far as I know, keeping a healthy diet.
There are some factors that will increase your probabilities of having a heart attack, like diet, smoking, and high blood
Another
pressure.
factor is being overweight, alcohol, and age. Also, if a parent had it, you can get.
You can avoid all these factors every day, so you are less likely to have a heart attack.
What I have heard is that your left arm suddenly feels a tension in your chest where the heart is, and you cannot move your arm. You feel very weak and you have to go to check to the doctor. It may be a myocardial infarction. Sometimes you can have symptoms or don't have symptoms at all. In a way that you don't have symptoms, it's called a silent heart attack.
The more signs and symptoms you have, is the more likely you have a heart attack.
The silent symptoms of a heart attack can be suddenly or slowly.
Every time you think you're having a heart attack, don't ignore it. Go for help because it can save your life. First of all, the doctor needs to make a surgery in which blood can circulate in your heart again, in a regulated way. I don't remember its name. I think it is angioplasty. In this procedure, it has a quick recovery, so you can go back to your house one day after and start working again a week later. However, according to the Prevention of Health, you need to start a diet in which it has no fat in it and doesn't cause a change in your arteries. Also to start exercising yourself in order to know how your heart is working and if it's going to be working as before. Finally, to take care of yourself in every single aspect.
There are two ways that you can treat an MI. One of them is an angioplasty, which is a tube connected to your arm all the way through your heart, which it has a bypass that spreads your artery so that...
But we want to base this project in the prevention of a myocardial infarction. There are 6 main things that we must take into consideration.
There are 2 ways that you can treat an MI. One of them is angioplasty, which is a procedure in which a tube is connected through your arm all the way to your heart, and a stent is put in your artery in order to extend it and get the fat away. The second way you can treat an MI is an open heart surgery, in which a surgeon opens your chest cavity and gets to the heart and start cleaning as much as he can from the artery.
We want to conclude this video so you can use these preventions as an advice and so you can have a high quality life.